discuss the clavipectoral fascia, describe the triangle of auscultation. Pectoral region is external to the anterior thoracic wall. It anchors the upper limb to the trunk. The pectoral region comprises of two compartments. The superficial compartment, which consisting of skin, superficial fascia and breast. And when we remove this superficial compartment, we could see the muscles and the associated structure. And this is actually the deep compartment of the pectoral region. The muscles of the pectoral region. Each pectoral region comprises of three muscles. The pectoralis major muscle. When we remove the pectoralis major muscle, we could see the pectoralis minor muscle and the subclavius muscle, which lies beneath the clavicle. All these muscles originate from the anterior thoracic wall and gets inserted into the bones of the upper limb. The pectoralis major muscle. The pectoralis major muscle is the most superficial muscle in the pectoral region. It is large and fan-shaped. It comprises of two heads. The head, which is originating from the clavicle, is called as the clavicular head, whereas the head, which is originating from the sternum, it is called as the sternal head. Clavicular head of the pectoralis major. It originates from the anterior surface of the medial clavicle. Now, as we all know that clavicle is a horizontal bone, so it has a upper surface which is called as the anterior surface and the lower surface which is called as the posterior surface. So the clavicular head of the pectoralis major originates from the upper surface, that is the anterior surface of the clavicle, and the medial clavicle means that one side of the clavicle, as it is a horizontal bone, the side which is facing towards the front is the medial side, and the side which is facing to the back is the lateral side. So the clavicular head of the pectoralis major originates from the anterior surface of the medial clavicle. Then comes the sternocostal head. The sternocostal head of the pectoralis major originates from the anterior surface of the sternum, the superior six costal cartilages, and the aponeurosis of external oblique muscle. Now, what are the costal cartilages? Costal cartilages are basically the hyaline cartilages that help to prolong ribs forward and contribute to the elasticity of walls of the thorax. Then what is aponeurosis? Aponeurosis is a type of deep fascia. Their primary function is to join the muscle and body parts they act upon. So the sternocostal head of the pectoralis major muscle originates from the anterior surface of the sternum, upper six costal cartilages, and aponeurosis of the external oblique muscle. Although the pectoralis major muscle originates from two different heads, that is the clavicle and from the sternum, but it gets inserted into the intertuberculous sulcus of the humerus. This is the intertubercular sulcus of the humerus, where both the heads, that is the clavicular head and the sternocostal heads, get inserted into the intertubercular sulcus of the humerus. The function of the pectoralis major is adducts and medially rotates the upper limb and draws the scapula anterior-inferiorly. The clavicular head also acts individually to flex the upper limb. Innervation would be the lateral and medial pectoral nerves. Then the next muscle of the pectoral region, that is the pectoralis minor muscle. As we remove the pectoralis major muscle, we could see the pectoralis minor muscle. Both of these muscles form part of the anterior wall of the axillary region. The pectoralis minor muscle originates from third to fifth rib. As we count the rib, this is the first rib, second rib, third rib, from which the pectoralis minor muscle originates from the third rib, fourth rib, and the fifth rib. And the pectoralis minor muscle get inserted into the coracoid process of the scapula. The function of the pectoralis minor muscle is to stabilize the scapula by drawing it anterior-inferiorly against the thoracic wall. Innervation would be the medial pectoral nerve. Serratus anterior muscle. Serratus anterior muscle is located more laterally in the chest wall. You could see the serratus anterior muscle which lies in the lateral part of the chest wall. It forms the medial border of the axilla. We have discussed that the anterior wall of the axilla is formed by the pectoralis major and the pectoralis minor muscle, whereas the medial border of the axilla is formed by the serratus anterior muscle. The muscle consists of several strips. The muscle consists of several strips. It originates from the lateral aspects of first to 8 ribs and it gets inserted into the costal surface of the medial border of scapula. Costal surface means that the surface which is facing towards the ribs. So the serratus anterior muscle which originated from the lateral aspect of the ribs, they get inserted into the costal surface of the medial border of the scapula. Function is to rotate the scapula, allowing the arm to be raised over 90 degrees. It also holds the scapula against the rib cage. Innervation would be the long thoracic nerve. Subclavius muscle. The subclavius is a small muscle. It is located directly underneath the clavicle, running horizontally. It affords some minor protection to the underlying neurovascular structures, example in cases of clavicular fracture or other trauma. Attachments of the subclavius muscle. First of all, locate the subclavius muscle which lies just beneath the clavicle. It gets originated from the junction of the rib 1 and the costal cartilages and it get inserted into the inferior surface of the middle third of the clavicle. This is the clavicle, this is the superior surface and the subclavius muscle get inserted into the lower or the inferior surface of the middle third of the clavicle. Function is to anchor and depress the clavicle. Innervation is nerve to subclavius. Clavipectoral fascia. The clavipectoral fascia is a thick bilateral connective tissue structure deep to pectoralis major muscle. The clavipectoral fascia extends from superiorly from the clavicle, medially from the costochondral joints. What are the costochondral joints? Costochondral joints are the joints between ribs and the costal cartilage in front of rib cage. So medially the clavipectoral fascia gets extended from the costochondral joint and superolaterally from the coracoid process. So the clavipectoral fascia extended from superiorly from the clavicle, medially from the costochondral joint and superolaterally from the coracoid process. The fascia converges in the axilla where it acts as a protective structure over the neurovascular structure of the axilla. Structures piercing the clavipectoral fascia are the cephalic vein. This is the cephalic vein, the lateral pectoral nerve, the thoracoacromial artery, and the lymphatics. Triangle of auscultation. The triangle of auscultation of the lung is a relative thinning of the musculature of the back situated along the medial border of the scapula. The boundaries of the triangle of auscultation are superiorly and medially. This is superiorly and medially by the inferior portion of trapezius muscle. This is the trapezius muscle. The inferior portion of the trapezius muscle form the superior and the medial border of the triangle of auscultation, whereas the inferior border is formed by the latissimus dorsi muscle and the lateral border is formed by the medial border of the scapula. The significance of the triangle of auscultation is it is an important landmark that allows for better auscultation during pulmonary examination. In clinical, we have winging of scapula. One of the actions of the serratus anterior is to hold the scapula against the rib cage. If the long thoracic nerve is damaged and the serratus anterior therefore paralyzed, a specific clinical sign is produced. In such cases as this, the scapula is no longer held against the rib cage and protrudes out of the back. It is said to have a winged appearance. Long thoracic nerve palsy is thought to most commonly occur from traction injuries where the upper limb is stretched violently.